My name is Gigi Cabrera. I'm a licensed mental health counselor, certified addiction professional, also certified sex therapist. I'm certified as an EMDR specialist and trauma. I am in charge at the Boca recovery of the track for Dialectical Behavior Therapy. For short, we call it DBT. DBT was created by Marshall Linehan with the philosophy of Buddhism and cognitive behavioral therapy. DBT has a format of 4 modules: mindfulness, emotional regulation, interpersonal effectiveness, and distress tolerance. An area that I concentrate a lot with our clients is in the connection between mind, body, and emotion. Because the individual had a disconnection with the emotions and the feelings, so therefore that's what we're reactive. And usually after we react and we have negative consequences, that's when we realize what we did. So what we're gonna learn with this series of skills and the modules of DBT is to be present in the moment, be mindful and aware of how are we feeling. The way that the addict thinks is panoramic vision. I want it all. I want it right now, my way or the highway. By being mindful, we're in the moment. Many times we find ourselves, either we go to the past or to the future. It's very difficult to be in the here and now in today. So what we do with DBT is we narrow and we help you learn the skill to be mindful in the moment. I can be mindful and I can be angry being mindful. I'm in the moment. I'm not in the past in regret or resentment, or I'm not in the future thinking how I'm gonna do this. Mindfulness helps us validate emotion in the here and now. We have the tendency to suppress many of our emotions. The individual have the tendency to suppress those emotions. Sometimes we do it intentionally, other times we don't do it intentionally. Every time that we say, whatever, where those emotions are going, we're suppressing and repressing. Sometimes those emotions, we remember them, other times we don't. When we're in early recovery, all of this stuff begin, all these emotions begin to come to surface. So it's many times we feel that we can handle the moment. So a good illustration about emotional deregulation would be, imagine a can of soda and we start shaking it and shaking it, what is gonna happen? It's gonna burst and explode. That's us with our emotion. That would be impulsivity or that would be rage. So now what we're gonna do, we're gonna take the can, we're gonna tap it, and we're gonna release a little bit. And when I release a little bit, I feel better, I feel good. I feel that I can do this. And we continue to open and release. That is emotional regulation. And when I feel that I am able to deal with this emotion, a technique that DBT have is riding the wave. What we want with the riding of the wave is for you to own that emotion and go with it. The surfers are looking for the big kahuna. That's that wave with the tunnel. That's what I want in your emotion. You can be angry in that emotion, but what are you gonna do to lessen that level of misery? You can come to the group and say that you're mad. Okay, so how are we gonna deal with that? Instead of saying whatever, suppressing and repressing. So we can use DBT for anxiety, depression, substance abuse, trauma. We can implement this in our activity of daily living. Usually people think that trauma, it would be sexual abuse or violence or anything like that. Definition trauma is any event that is a threat to the life of the human being. That's a traumatic event to the individual. So sometimes what is traumatic for me, it will not be traumatic for you. And that doesn't mean that it's any less. It's trauma. So we suppress and repress those events in our life. Sometimes we don't remember. Other times we remember, but we keep them in secret or shame. we don't share that. So when that, all of this is beginning in the journey of recovery, all of this begin to come to surface when we're doing treatment, and many times the individual is having these overflow feelings that are coming from traumatic events that they didn't remember. So DBT also help how to deal with those emotions, distress tolerance. The way that DBT is offered in Boca Recovery, we do a weekly group of 2 hours. At the beginning of the group, we do an introduction of the skill that we're going to discuss. The second part of the group is trying to see how I can implement this new skill in my activity of the daily living. So individuals are encouraged to practice the skill during the week, and the next time that we have the group, we revisit how do they use that skill, how they were able to apply it in their life, and what would be the areas that they needed more help. One of the uniqueness of the program Boca Recovery is that it's individualized treatment for our clients. With this thought, I want you to think about this. Do you have substance abuse because you have anxiety? Or you have anxiety because you have substance abuse? Or you have substance abuse and anxiety because you have trauma? Or you have trauma because you have anxiety or substance abuse? It doesn't matter. This is like what came first, the chicken or the egg? It doesn't matter. So that means that we're going to address all of them at the same time. That's the beauty of this place, treating them all together.